Thank you for being here. My name is Jennifer Blatherwick, and I'm BC's Parliamentary Secretary for Gender Equity. And I'd like to acknowledge today that we're on the unceded traditional territories of the Musqueam, Tsleil-Waututh, and Squamish peoples. It's a privilege to be here on these lands today for this announcement and to work, learn, live, and exist with my families. I'm joined today by Minister Josie Osborne, BC's Minister of Health, Dr. Ken Seathram, an IVF specialist, and Rochelle Pastila, a potential IVF patient. And without further ado, I would like to invite Minister Osborne to tell us more about today's announcement.
Thank you so much, Jennifer. Here we go. Thank you for the warm welcome, and good to see everybody gathered here today. I'm Josie Osborne, BC's Minister of Health, and I too want to acknowledge what a privilege it is to be here on the lands of the Musqueam, the Squamish, and the Tsleil-Waututh peoples, and express my gratitude for their stewardship of this place, and for those of us who are lucky enough to call it home or to work here. It really is fantastic to be here to talk about this incredibly important step that the province is taking to support families in British Columbia. For many individuals and couples, the path to parenthood isn't always easy. Infertility and other barriers can be truly devastating for hopeful parents. It's emotional, it's overwhelming, and it can take a real toll on your well-being. And on top of that, the cost of treatments like in vitro fertilization is simply out of reach for many. That's just not right, because having a child shouldn't depend on how much money you make. And that's why I'm so pleased to be here today to announce the launch of BC's first ever publicly funded IVF program. Our IVF program will help reduce the financial burden this costly process can have on families, support more people in our province on the path to parenthood, and ultimately change lives. Starting today, eligible BC residents will have access to one-time funding of up to $19,000 towards the costs of a single standard IVF cycle. This includes the costs for treatment and medication, and we're working with Olive Fertility, the Pacific Centre for Reproductive Medicine, and Grace Fertility for the delivery of this publicly funded IVF program. Funding will be based on household income to ensure that more individuals and families can benefit from the program with greater support for those who need it most. It's estimated the program will fund between 1,100 and 4,500 IVF cycles with the funding that's available this fiscal year. But this program is about more than providing financial support. It's about giving people in our province more options, so no one has to choose between money and their dream of starting a family. The launch of our IVF program is an important step towards a more equitable public healthcare system that ensures people in our province can access the care that they need regardless of their ability to pay. It's about making sure that people have the chance of realizing their dream of becoming a parent. Our government is continuing to take action to strengthen access to healthcare services across British Columbia. We're continuing to build a healthcare system that puts reproductive autonomy and gender equity at the center. We became the first province back in 2023 to provide free prescription birth control to all BC residents. And since then, 350,000 people have accessed free birth control. This saves women, non-binary, and transgender people money and allows them to make choices that are right for them. We've also expanded the pharmacist's scope of practice so BC residents can walk into a pharmacy and get birth control quicker and easier than ever before. These are the kinds of initiatives that improve the quality of life for people throughout their lifetimes. Our announcement today really reflects our core values, which are grounded in individual autonomy, equitable care, and reproductive rights. We're committed to building a future where people can access the care they need, no matter how much money they make, and have the support that they need to start and grow their families on their own terms. Parenthood is a beautiful and transformative journey, and BC's first ever publicly funded IVF program will ensure that more people can access this life-changing treatment and bring hope to thousands of British Columbians on their path to parenthood. So thank you so much, everyone, for being here today, and I will turn it back to Jennifer. Thank you.
So thank you, Minister Osborne. This is truly a meaningful step forward, one that will bring hope and opportunity to so many people throughout this province. And next, I'd like to invite Dr. Ken Seathram, to share his perspective as a leading family specialist.
Well, thank you very much for the invitation and to the honorable ministers here today and to all of you present. You know, I think as fertility providers, one of the most crucial things that we prescribe is hope. And many who struggle with infertility feel quite hopeless to decide the number and the timing of the children that they want in their family. We all have a fundamental right to obtain the best possible physical and mental health, but fertility can jeopardize that right. Hope gets replaced by despair and fear and anxiety. 1 in 6 people globally suffer from infertility, and access to fertility care is a fundamental and essential human right as defined both by the World Health Organization and the UN Sustainability Development Goals. Infertility affects populations, it affects society, and it affects human productivity. Canada has a declining birth rate. It actually falls under our population replacement rate. And social and economic factors are the barriers that play a role in this decline. In British Columbia, we also have a problem that we have the highest age of first pregnancy in the nation. People are postponing childbirth, and this further compounds the birth rate issue because this delay collides with the age-related decline in fertility. One of the most successful treatments that we have in the fertility world to cure infertility is IVF. And in this process, what fertility centers do is we give medications to help rescue eggs, and we use those eggs to be fertilized outside the body to create a fertilized egg. That's called an embryo. And when you place that embryo back into the body, the success rates are very, very high. Creating these embryos also allows the opportunity to do other things like test them for genetics or freeze them to allow a patient to expand their family in the future by replacing that embryo. Many people face barriers to this fertility care, including the stigma around infertility, and that's made worse by the financial burden of IVF treatment. This cost burden further erodes hope. Today, however, that changes. We are very fortunate to live a time and a place where progressive policymakers and reproductive science can merge to provide and revitalize hope. BC's new funding program draws from a national experience, stakeholder input, expert input, and this has resulted in a very progressive model which can scale and expand in the future. The program of provincial funding will enable infertility treatments for patients who would not otherwise be able to access IVF care, and that restores hope to people who need it most. Thank you very much again.
Thank you, Dr. Seathram. You are absolutely right. This new funding will open doors for people who could not otherwise access IVF care. It's an incredible and a much needed initiative. And next up, we are very happy to hear directly from Rochelle, who is planning to go through IVF personally.
Good afternoon, everyone. I just want to start by saying thank you. Thank you to everyone who's played a part in getting IVF process funded here in BC. This is going to make a huge difference in so many families' lives, giving people the chance to create families they've been dreaming of. In 2008, I was diagnosed with endometriosis. Hearing that news and knowing having children might be a struggle was really hard. Being a mom has always been something I deeply wanted, and that diagnosis felt like I had a weight I had to carry. Since then, I've gone through 2 major surgeries to remove cysts and manage the endometriosis. But as many as you know, there is no real cure unless you have it surgically removed, and it's something I still live with every single day. In 2021, we are incredibly blessed with our son, our miracle baby. He's the light of our lives, and he's made every challenge along the way so worth it. But we've always hoped to grow our family, and for the past 3 years, we've been trying without any success. That has led us to the IVF journey. Knowing that the government is stepping in, helping with funding, and making a difference, it brings real hope, not just for us, but for so many out there who are going through the same thing. I also want to say a huge thank you to PCRM's team that has been amazing with the start of my IVF journey. So again, thank you from the bottom of my heart. This means more than words can say. From my family and countless others, here's to one step forward for helping families. Thank you.
Thank you, Rochelle, for bravely and openly sharing your journey with us. Your story conveys why this program matters so much. It's incredibly powerful to hear from people, real people like Rochelle, how this program will change lives. And also for so many people across this province who have been waiting and hoping and trying to expand their families. We know that infertility can take an emotional and a mental toll. And the high cost of IVF has been a barrier for some families. And some couldn't overcome it. This program is about giving people, especially women and gender diverse people, the support they need to make choices about their own future. Those who dream of starting a family don't have to put it on hold because of their finances. The province is here to support them every step of the way. And this is about more than just funding. It is about fairness, it is about choice, it is about autonomy and compassion. It's about building a future where everyone, regardless of their gender, relationship status, or income, has the opportunity to thrive. We want to make this province a better place for women, a more equitable place for gender diverse people to live. Thank you all for joining us here today. And now Minister Osborne will take questions.
Good afternoon. Good afternoon. Thank you for joining us today. For the media on the line, please press *1 to enter the queue. You'll have one question and one follow-up. For the media in person, you'll have one question and one follow-up. Please say your name and your outlet. We'll start with our in-person. Go ahead.
Hi, Grace Key with Global BC. Just a couple of questions. How much is the first stage usually? And you said public funding would pay for the first stage. Can you just explain a little bit of what the first stage is? You said there was a high success rate. What is that success rate?
I can answer the first part of the question, and I might hand it over to Dr. Ken for the second part. So this is about one-time access to funding of up to $19,000 to cover a single standard IVF cycle. That includes the treatment and the medications. The medical services plan, BC's MSP plan, already covers fertility consultations, investigations, and diagnostics and treatment. That's already covered today, but this specifically is geared toward the IVF cycle itself. And so for your second question, I'll pass it over to Dr. Ken. Thanks.
With regards to success rates, they are age related. The younger an individual is, the higher the success rates with IVF are. We're lucky to live in a province with multiple IVF centers that have almost the exact same success rates, very high performing centers. And so for instance, someone who's 35 might have a success rate between 50-60%, but we also talk about cumulative success rates. So one IVF cycle can make several embryos. So if the first attempt fails, the patient doesn't have to undergo IVF all over again, rather than just an embryo transfer.
A follow-up.
Yeah, so I also had a question for the minister unrelated from Richard, if I can ask that. A Victoria bike shop owner who was attacked on Sunday outside his shop is saying the province has not done enough to address crime and mental health and addiction issues in the city's downtown core. What measures is the province taking to increase mental health and addiction supports connected to Pandora, Princess, and Victoria's downtown?
Yeah, thank you for the question. This is such incredibly important work, supporting people with mental health generally, as well as serious mental health issues. And substance use addiction. That's why we are so focused on building out the continuum of care along the entire spectrum, from prevention and harm reduction to increasing the number of treatment beds and recovery centers, doing the work with youth, for example, through Foundry, standing up the Circle team in Victoria, a fantastic team of specialists who are there to intervene and assist people in mental health crises, and doing good work that actually helps divert people from having to go to the emergency room, for example, and really cares for people in that time of crisis. We recently opened a 20-bed therapeutic recovery center in View Royal for women. These are just some of the examples of that work. We're going to be building out the Road to Recovery service that right now operates downtown Vancouver in the Vancouver coastal health area, and increasing access for people to mental health supports across British Columbia. Also on the subject of Victoria and Pandora, very aware that the City of Victoria has recently put out their community plan, and look forward to discussing that further with City Council and continuing to do this work. This is work that requires the collaboration of all levels of government, and we're deeply committed to continuing that work. Thank you.
Our next question, please say your name and your outlet.
Hi, Anaïs Elboujdani with Radio-Canada CBC. I was wondering how you answered to criticism of only one cycle being covered, and also how many people are you expecting to take part of in that program?
This is a really important step forward in being able to provide access to funding for people who are waiting to start families and face barriers, including financial barriers, around accessing IVF care specifically. I'm really proud of the fact that British Columbia is joining many other provinces and territories across Canada in being able to support women and people, families in this work. And we want to make sure that we can stretch the dollars to help people as much as possible, as well as those people who face the highest financial barriers, which is why there's an income testing element that's been introduced to this program, so we can ensure that the most number of people can access this. Right now, because we don't know exactly how many will apply and exactly what income levels they will be at, we're estimating between 1,100 and 4,500 cycles will be able to be funded. And of course, we're going to very closely monitor this program and the success of this program over the year, so that we can make changes as necessary moving forward.
Do you have a follow-up?
Yeah, it's unrelated, but I was hoping to hear some updates on the Kelowna pediatric unit, and also if you were planning to go there in person, or what kind of, where are we at?
Yeah, thank you for that. So on Monday, I spent the day in Kelowna, and I was at Kelowna General Hospital. I met with hospital leadership, with Interior Health, with physicians from different departments, including the pediatric department. And I know that this has been a very stressful time, particularly for Kelowna families, but also for healthcare providers who are doing the very, very best they can in an extraordinary set of circumstances. Interior Health took a difficult decision in closing the pediatrics unit temporarily so that they could focus the pediatricians who do work there on the essential work of supporting emergencies, supporting the critical care that infants and children often need. And they are doing everything they can, working with Interior Health, with the Doctors of BC, establishing an action plan to reopen the pediatric unit as soon as possible. What I heard when I visited physicians and heard from them is a true desire to collaborate, to work constructively towards reopening not only the pediatric ward, but also understanding the impacts it has on other departments inside the hospital, and working towards the safe, supportive, respectful working environment that we need to see in healthcare facilities around the province. So this will take some time in rebuilding relationships and trust, but this is work that I heard a lot of commitment toward doing, and work that I have personally expressed my support directly to physicians, to hospital leadership, and to Interior Health about that work, doing it together moving forward, so that Kelowna has a resilient and strong hospital and is providing the services that people need.
Thank you. Our next question will be on the phone line. It will be Keith Norbury, BC Today. Keith, go ahead.
Oh, hi. Yeah, this is for the minister. It's an unrelated question, but I'm wondering, we're talking here about in vitro fertilization. There's a child who's very much alive, as you're well aware, who's having her medication cut off. It's costing $800,000 a year. I'm just wondering if the minister is going to be able to release the advice that she's received from the experts on that spells out the reasons for denying that coverage, especially given that her own family physicians and other experts in this area have testified that this medication really is life assisting. What can you say about that?
Yeah, thank you so much for the question. I mean, first and foremost, I think it's just so important that we focus on how incredibly challenging this is for any family who receives a diagnosis like this for their child, facing a rare disease that shortens life expectancy. And we all, I know everybody, empathizes deeply with Charlie and with her family, and that all of British Columbia's hearts are going out to them. This is a journey, I know, for the family that has been filled with uncertainty and fear and endless advocacy. And we all want to do everything we can to support this family, this young girl. Decisions like these are made through an independent review process by experts in this field. And under BC's Expensive Drugs for Rare Diseases program, there are established criteria that have been laid out. Now, when the family physician brought forward their concerns and new evidence, that's why we wanted to make sure we left absolutely no stone unturned in this and ensuring that the Canada Drug Agency had an opportunity to review the new evidence, because these criteria for discontinuing treatment like this were established in 2019. That report is publicly available, and people can see that. And as people will see, the decision has not changed in terms of this. And I understand how incredibly difficult this is, and I think this has been something that is hard for everybody to imagine, and especially, of course, for Charlie's family to have to endure. It's important that we use established scientific medical processes like this. It's important that they be robust and evidence-driven, and that these decisions are made by experts and not made by politicians. But again, that's why we asked the Canada Drug Agency to review all the new information that was available, and it is just heartbreaking that the decision has not changed.
Do you have a follow-up?
Okay. Well, yeah. So I understand, though, that Alberta and Ontario do approve this drug. So what's different about their processes than the ones in BC? Why are they, allowing this drug to be used in a similar situation as this one?
Yeah, so when expensive drugs for rare diseases altogether each have different sets of criteria, again, that are based on evidence and clinical trials. It's a challenging field because, of course, a rare disease means there are not very many people for which to do robust clinical trials, and that adds an element of challenge to this. With this particular disease, with Batten disease, there are other children in Canada who have been diagnosed. Other provinces do have criteria that's identical to what British Columbia uses in terms of when to start, how and when to continue the use of a drug, and in this case, when to discontinue. And those discontinuation criteria, again, based on the evidence that's been brought to light so far over the past years, and knowing that when the progression of a disease is advanced to a point that it is deemed that the drug no longer has the effectiveness, the efficacy that one would hope that it does. And again, this is just tragic and awful and terrible news for any family to receive. And just as it is in other cases of less rare diseases, for example, cancer care, when it's deemed by a team of physicians that a particular therapy is no longer working and is effective, these are terrible decisions and very, very challenging for any physician or expert to be in the position of making, and of course, really, really difficult for families and for people to face.
Our next question is from Glenda Looms, Vancouver Sun. Glenda, go ahead.
I was just wondering if you could explain the income testing a little bit more. What threshold have you set then for who's eligible and who might not be?
Yeah, thanks for the question. So again, we introduced, there's an income testing element to this so that we can ensure that we are able to help as many people as possible, and particularly those who face the more financial barriers because they may have a lower income. And we don't want anybody to be limited in their access to IVF care because of their ability to pay. So we have used an income testing program where we will fund up to $19,000 for that single standard IVF cycle. and we'll cover 100% of that for those applicants who have a combined pre-tax income of $0 to $100,000. And then it's stepped up to $250,000 of a family income where support for this would not be available. And so from 100% to 75 to 50 to 25% to not being eligible. This is, again, something that we'll be very carefully monitoring along the way throughout this year so that we can understand the demand for this and where people are at, and then make tweaks or adjustments to the program as we can moving forward.
Do you have a follow-up?
Yeah, I do. Thank you. Just wondering about a wait list. Like if the program is sort of overwhelmed by people applying in the next month, and the funding only kind of lasts for 2 years, I think, will there be a wait list? How will you prioritize people? Will it go by age or by income? And then what if there are people that haven't gotten the treatment before the money runs out?
So this is a first come, first served program that will be delivered in our partnership with the fertility clinics. So a person is a patient or a client of a fertility clinic, they've had their medical consultation, they're working with their fertility expert, and the package will be submitted to the Ministry of Health. We estimate it should take about 30 business days to be able to process that for a complete application that comes forward. And then we will be able to disperse the funding until the envelope of funding that's been set aside for this year is completed. And then we'll start again in the following year. So wait lists are, again, something I can't really estimate what the size will be right now. We don't really know. This is the first time that British Columbia has undertaken a program like this. And again, we'll be really carefully monitoring and watching that and working with the fertility clinics themselves as well.
Okay, and that concludes today's event. Thanks so much.
Okay, thanks so much, everybody.